All right, we are live, and Brooks and you, and I'm so excited to talk to the both of you today because your topic, your mission is so inspirational for me and so needed. This conversation is needed. And honestly, I have not heard of this except for one other source through my company, Total Health, about what you're going to talk about today. And so I am glad we're able to bring this to the forefront, and hopefully after this after this tea talk, people will actually reach out to you to get more information, because I think this is a needed conversation. I hope you guys get a lot of speaking engagements, because I think this conversation needs to be had. So why don't we start with you guys? Brooks, why don't you introduce yourself, and then we'll have you introduce yourself.
Okay. Hi, everyone. I'm Brooks Nelson. I'm a filmmaker, documentary filmmaker, live in Portland, Oregon, with my beloved spouse of 27 years earlier this month. And we have an 11-year-old.
All right. Yuan?
Hi, my name is Chong, and I live with Brooks and Brooks's beloved and the 11-year-old. So we consider ourselves chosen family.
Yeah. Now, Brooks, I like how you just left out that little detail, the beloved spouse, but all right. So you have a documentary, Trans Dude with Lady Cancers. And so we want to get now as to what inspired that, and I want to talk about your own journey. And you guys can decide who goes first.
Sure. So as a documentary filmmaker and someone who really recognizes the role of media and the power to change minds and hearts, Yuan and I were diagnosed with cancer in the same month. I was diagnosed with ovarian cancer, and Yuan was diagnosed with breast cancer. And that took all of our attention. And partway through that journey, as organizers and people who have done work, political organizing and work around kind of a broad-based, progressive, inclusive, what we realized is if we could share the story of what was going well and what was really hard, then we may be able to make a positive impact and have that be as broad as possible. So add some more detail about how the story even started.
Yeah, so I had stage 2 breast cancer, and I went through chemotherapy, surgeries, and also radiation. So at some point, it was, I just had no space, energy, or any of that to do a documentary. But then we were, because of who we are in our backgrounds and using storytelling, we were like, we have to do something. What are the chances, right, of the two of us living in the same house? We're a chosen family. We are both transgender masculine and going through cancers that are typically viewed as gender cancer.
Right.
I was invited to do a talk, but I was so sick I couldn't do it. But that's where we came up with, what could potentially be the name for this talk to get people's attention.
Yeah.
We came up with the name, but I didn't do the talk. And so then we were kind of like, and I was feeling better, and we were like, okay, we need to do something, and we'll make a documentary. And the documentary is 30 minutes. And we were very intentional about that. Because we knew that it was very possible for places to organize events that are 60-minute long or 90 minutes long if we show the film and then have a Q&A afterwards. That will make it at least reduce a barrier for places like hospitals, schools, that to do something and bring us in, so that we can talk to them and help them process the movie after they have seen it.
Let me add one more thing, before we get into more discussion. When Yuan was talking about why on earth would we do it, we actually get asked that question quite a bit. why in the midst of two separate cancer diagnoses and the impact on your family would you take on something as burdensome and time consuming as creating a documentary? And we realized if we were going to do it, if we were going to make this commitment, we had to be able to have kind of some guide or some way to know that it was worth it.
Right.
And so we came up with 4 primary goals, and we were like, we'd like to share those with you right now, if that's all right.
See, I got my pen. I'm like, all right, let me hear these goals, because it's probably going to be something you can use for not just this, but anything in life. So yes.
You want to do goal 1?
I'll do goal 1. So goal 1 was to increase the awareness among transgender people. We often actually have to educate our healthcare providers. And also our healthcare providers actually give us the wrong information. So for instance, I was diagnosed with breast cancer, stage 2 breast cancer, after I had top surgery. So top surgery is when transgender people remove some breast tissue and their chest is sculpted. So if they were their sex is assigned female, they might do that to in their transgender transition, right? And so in those kinds of surgery, sometimes surgeons would tell their patients that they no longer have to worry about breast cancer.
Really?
Yeah.
Okay.
So what happens is also primary care physicians are not trained in this. So they don't know, some are not trained in this. So they don't actually examine their transgender patients. So not only, right, that they don't do the pre-cancer screenings, but also giving wrong information. So that's an example around breast cancer. And but of course,
before we go any further, because I think it's you're making, and I think I mentioned to you guys before we got on here that I've heard one doctor in all the doctors I'm hearing talk about when transgender come into your office, because the flip is also the other way too. We have trans women having prostate cancer, so it's on both sides. And is it a lack of knowledge? Is it discomfort? I don't know what it is, but I'm glad that you guys are doing this on the awareness piece, because this is going to become more and more of an issue, and we don't want people suffering in silence. So I'm really glad that that was goal number 1, increasing awareness. So I didn't want to cut you, but it's also, trans ladies having male cancers. That's also happening. Yeah.
Correct. Yeah. And it brings up a lot of discomfort for everybody, right? If I bring up discomfort for the trans person, it will probably bring up discomfort to the provider. So our tagline for this part is pretty simple. If you have the part, get it checked. And then for healthcare professionals, they have to also rewire their brain in how they think about sex and gender.
Yes.
And that's not often taught in medical schools.
Yeah. I just wanted to say, if someone on my team could just put this tagline that you have: if you have a part, get it checked. I think that's so important. If Peter or Maureen could just put it in the comments, because I want, when the replay goes around, that some of these comments are just, pops for some people. If you have a part, get it checked. It's the same thing that the other doctor said about lung. If you have lung, you can get lung cancer. It doesn't have to be a smoker. This is the same thing what these wonderful guys are telling us. If you have a part, get it checked. Okay.
Yeah. I mean, before we go to goal 2, I see a question down here.
Yeah.
Do you see it too?
Yeah. What I'm wondering, did either or both of you take hormonal therapies, and were your cancer suspected to be related at all to that? Okay. So that's a good question. So prior to the cancer, as you guys were transitioning, did you guys take hormonal therapies?
Yeah. Well, so this is related to this goal.
Yeah. Okay.
Right? that it is a myth that transgender people taking hormones and the hormones is related to the cancer or cancer causing. And this is often what we also have to face, right? In both ways. It's such
Yes.
a widespread myth that transgender people actually feel bad, right? And blame the cancer on themselves.
I see. Yes.
There are no credible research that has found this that to be true. And then and when doctors and nurses have this myth, believe in this myth also, then of course it creates even more of a burden on the trans person, right?
So
And
it's
so
almost like what you're saying, you want when you go to the doctor and you have the situation, it's almost your feeling is almost like a subconscious blame game that
sometimes it's subconscious, and sometimes, like, I think my doctors have kind of like not wanted to bring it directly but almost bring it up. So there's this situation that is almost microaggression, right?
yeah, yeah.
And because it's like they heard it somewhere, but they cannot
Mhm.
back it up with any viable or credible research.
Gotcha. Good point.
And if anything, because we have shown this film to many medical schools, and there are some schools that we've gone to, medical centers that we have shown this, have actually told us that they actually have done research and this is not true.
Gotcha. Gotcha. Good. Good. Okay. There's some questions coming in, but I want to have you finish those 4 goals first before we take any more of these questions.
Yeah. Goal 2.
Goal 2 is absolutely related. So if we're going to ask folks, if you have the part, get it checked, we have to make that experience as comfortable or as reduce the trauma in it. So goal number 2 is to speak directly with practitioners, people who work within the medical systems, doctors, nurses, front desk people. What could they do to make that visit less traumatic? We have, because, and it's not just trans folks who don't like going to the doctor. It's everyone.
Right.
It's never fun. So
Right.
when there are additional barriers set up, it becomes easier to skip it. And so as we are encouraging trans folks to go see your doctor, at the same time, we're talking with those practitioners, doctors and practitioners, about how to make that easier to be there. And then the other thing, which has really started to come out of that, is you have to figure out how to get that patient to yes. Yeah, I am willing to have that test. Yes, I realize I have it. No, I can't do it this time. I can't. I'm not up for it. But yes, I will do it. So ask, how can I support that? Do you want an advocate? Tell me, give me some information in a not super intimate environment, like sitting. I had to have my checkup just earlier this week. I don't have that conversation when the patient is sitting on the table wrapped in a sheet.
Yeah.
Right?
Yeah.
Take a minute and figure out what steps could practitioners take to make it easier to get the parts checked.
Let me ask you something. How has that been for you? How has that been for you, that experience in terms of educating this practitioner? Because that's one of your goals, but I would imagine there's so much, you want to talk about microaggression and sometimes maybe even open aggression, who knows, right? I mean, really. But you feel like you're making leeway with that? Because I know one of the questions we're going to talk about was the healthcare practitioners who participated in the film. You had to choose the right ones. How receptive? What are you guys finding? How receptive?
I think it's working.
Oh,
good. That's good to know. That's that's good to know.
I do think it's working, and we are, changing one place at a time.
Yeah.
And so the people who are attending the film screenings that we do are getting the information. So, but we need big systemic change.
Yes, yes,
That
yes,
rolls right into goal 3,
It
really,
does. Yeah.
because goal 3 is to inspire those practitioners to advocate for change within the institutions where they work,
yeah,
because no one has more power than the people who are in the system.
yeah.
So if we could inspire that one practitioner who opts in, right? I'm opting into a live stream. I'm opting into a screening. How do I get people who are not actively opting in the same
Mhm.
information? So when they go back into their mentor or whoever, or whoever's in charge of continuing education units at their hospital, then and advocate for this as a program, then we're broadening that net so it's not just opt-in people.
Right, right. That's true. And you found that again, you've been making some progress with that. You're finding that they're trying to do that, trying to spread the word out there.
Yeah. I mean, one of our kind of magic wand when we decided to do this film is that this topic, not necessarily the film, although it would be nice, is included in the curriculum for medical schools and nursing schools.
I think it
So
should.
we are happy to announce that this year, UC Davis School of Medicine is actually using our film for their first year students curriculum.
All right,
That's what we want,
congratulations.
right?
That's
Like,
awesome.
start at the get-go,
Yeah.
instead of like doing it as continuing education, because the continuing education and screening, we're getting audience that already have some awareness,
Mm-hmm.
already have heard or come across people that are transgender like us, and then they're like, oh, I need more education. But there are
Mm-hmm.
so many people out there that also need this education.
Awesome. All right. Before you go to point number 5, let me just take a because they're kind of like piling up over here. So let me just get some over here. So I believe there's been some research suggesting that primary care physicians and other clinicians feel they don't know enough about these issues and desire more education. So what you're saying, I mean, there's something they can do. First of all, I mean, I'm hoping that you guys have a platform where you're getting your word out huge, because this is something that needs to be out there. The UC Davis thing is good. I mean, that's a big, big thing. And hopefully others will follow, right? Because you always need someone to start first, right? Always need someone to be a, barrier breaker, that, trendsetter. So hopefully that's going to, open more doors for you, because that is such a cool thing. Then there's another question. What was your experience with your healthcare providers, and do you feel they were sympathetic to your situation? And I believe, Brooks, you were talking about, something that you said, and you're right. Who likes to go to the doctor? And you're right. When you're in that plastic thing, it's very uncomfortable to have conversations, right? It just is. It's just hurry and get that done, and then let me sit back up. So, so like you said, with additional barriers, it's even more complicated. So I guess have you guys feel like you've been getting sympathy with your particular providers?
We have. So, I mean, I also want to acknowledge that we live in Portland, Oregon, and so we have advocacy organizations that have pushed for a lot of inclusive laws and practices. So we are fortunate in that way. And when I moved to Portland about 16 years ago, I was very intentional in finding a provider that is competent, and kind of promote themselves as a transgender healthcare practitioner.
Good.
And I often talk about how this doctor, who is a naturopathic doctor, saved my life. One thing to note, right? Like I had explained, like top surgery being different from double mastectomy. Two different things.
Is it?
It
Okay.
is. It is.
I never thought of that.
Yeah.
Okay. Can you flush that out?
Well, double mastectomy, you remove the breast tissue,
Mhm.
right? For top surgery, you don't remove all the breast tissue. You reduce the breast tissue, and the chest is sculpted. So to look like a male chest, because
Right. Yeah.
men get breast cancer as well, right?
True. True.
And so you still have some breast tissue in there. And our Dr. Scopes, my primary care physician, who is also a naturopathic doctor, continued to give me chest exams after my top surgery. And it was in one of those annual exam where I was feeling great. I had no symptoms. I was feeling like it was one of my first annual exam where I had nothing to complain about.
Right.
And she felt it. She's like, I feel something here. We should have you get an ultrasound. And I got an appointment right away. She arranged that. They saw something. They said, we want to give you a biopsy and we can do it right now.
Yeah.
And that's where, right, like everything started, like I started getting the bad news. And
Mhm.
then Dr. Scopes then was the one who found me my medical oncologist. Not only found that person for me, but talked to that person and said, have you seen a transgender patient before? How much do you know about treating transgender folks? This patient that I'm going to hand off to you is transgender, right? And so from the get-go, my primary care physician laid out as easy of a path for
Mhm.
me. And even with that, we still
Yeah.
had issues, right?
Of course.
Once I go into like surgery, and I'm now like dealing with a lot more people.
Yes.
So
Yeah.
anyway,
Well,
Yeah.
I also am a big fan of Dr. Scopes, and my gynecological oncologist, who I get my healthcare through Kaiser Permanente, a giant HMO,
Mhm.
and that, and no one in the medical system has time, right? The
Yeah.
pressure on people who work in the system is incredible, and we've learned so much about that. But the time it takes to read a file,
Yeah.
or like be able to pick up the phone and make that phone call, and yet Dr. Steiner, my gynecological oncologist, did it. So
Yeah.
he knew, in order for me to be treat this whole person within this system, I need to make that phone call and just say, "Hey, Brooks is coming over. This is the deal. Didn't want you to be surprised. You probably don't have time to read the file, but I wanted you to know before he got there."
Got you.
And that was it made such a difference in my life.
Yeah. I can see that. I did a talk in Memphis earlier this year on the importance of empathy in healthcare and how it makes such a difference to our trajectory when we get diagnosed. And it's such a challenging time. And of course, it's double challenging for you. But just what that doctor did, I talked about in my experience how when I was getting the bad news and when I had to go in, the doctor sat beside me in the middle of me and my husband and showed me the diagram and said, okay, here's what it looks like. And it's going to be okay. I mean, yes, we have to do certain things, but just the fact that she sat in the middle of the both of us made me feel hopeful. And it's the same thing that you guys are saying, just the phone call to like, hey, I'm going to prepare you. My patient is coming over. Be prepared. Just paves the way. And again, empathy in healthcare is huge. Can I ask you, Brooks, Ewan talks about how his was diagnosed, right? How he was doing his annual exams. Was that how you found out about the ovarian cancer as well?
No. So I was having all kinds of symptoms, and we talk about it a little in the film, but it was like I have been having issues, and then right after the winter holidays, it got much worse. So then I thought I had food poisoning. Then I thought I had worms. We couldn't figure it all out. I couldn't get any traction, and I could feel something in my gut. And so I couldn't get what I needed from my HMO. So I called Dr. Scopes, and because I've had an ongoing relationship with her, and I was like, Dr. Scopes, just something's not right. Can I just come in? And she was the first person in many, many instances of seeing doctors to put her hands on my belly. And she was like, dang, what is this? You need to go in, because she could feel the tumor.
Wow.
Yeah. So it was over 5 pounds when it came out.
Are you serious? Wow.
Yeah. So seeing a gastroenterologist, seeing people in urgent care, having people say, oh, it's just how old you are, or it's just this, or it's just that. And a doctor in 15 seconds, by putting her hands on my belly, by listening to the patient and saying, something's not right here. Then she picked up the phone and called Kaiser and was like, something ain't right. You need to get this guy in.
Gosh, I really wish doctors would see this tea talk and to see your film, because I'm sure you guys go into details with that. But God, just that extra step saved your life. Just that extra step saved your life. All right, so let me just see if I can take a couple more questions.
This question that I just want to mention, like, for the most part,
yes,
we feel like people try their best, right?
Yeah.
And a lot of times is because they don't even have the basic understanding of transgender people. So, are they sympathetic? For the most part, I don't think we came across anyone who were like outwardly, explicitly, discriminatory. But still, with that, it wasn't easy.
Yeah. We talk about, disparities in care. We talk about, all the issues that underrepresented groups face. And I've been fortunate enough to be in rooms with doctors who openly admit that there are unconscious biases and even conscious ones. And for me, I admire that. I admire when a doctor can say, I am working on my biases and on my unconscious biases and my conscious ones. Because I think to some degree, we all have a little. And I think we could make progress if we can recognize that I have something here up against this race or this group or this, this age group, this sexual group. I have something and I am conscious of it and I want to work on it. I can respect that. Just do the work, So we have a question. Being on hormonal therapy, did you mix hormonal changes with the signs and symptoms of ovarian and breast cancer? And did it delay making your doctor's visit? So that's a good question.
Yeah. I actually have kind of a funny answer to it. And the answer is yes. And that's because one of the hormonal changes that was significant for my body is your fat moves, right? So my butt fell off.
So I don't want to laugh at you, but
no, it's all right. It's funny. But it was like, somebody would say, what happened to your butt? And I would be like, it moved around to the front because that's right. So I carry more fat in front. And I also like beer. So I was like, my butt became a beer gut. And and my age. So if my fat hadn't moved, then maybe I would have seen it sooner. But so I think it did actually have an impact.
That's a good question, Maureen asked, because you're right. I never thought of that, but it's true, because you expect certain changes with the hormonal therapy. You're like, okay, this is all part of it, but it probably wasn't, right? So she said, LOL, because that is funny. And it was funny. And I didn't know that happened. Is that a fact? Is that something that does happen when you take this therapy, that your butt could fall off and come? I mean, is that real or is that just you?
Well, we're taking testosterone.
Yeah.
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 So
people with
so it reduced your butt and it gave you a beer belly. Wow.
Yeah. Because people with more testosterone in their systems carry fat in different places.
Yeah.
So it moves.
Got you. I have another question from here, and then I have a question for you. So you were very intentional to find the right medical care. What would you suggest for the person who is not satisfied with their provider?
Find another one.
Yeah.
I mean, you know, I guess on the flip side, what we would tell a provider, again, right? We had mentioned earlier, is this is uncomfortable for everybody, and also for a doctor or a nurse. I actually think I also admire folks who can just name that right outright. And then I also think that there are situations it probably is good to just say, be conscious and self-reflective and say, oh, I am uncomfortable.
Mhm.
And then after the appointment, go do a bunch of research, right?
Yeah.
Like go and do a search, watch videos, and just know that the discomfort will always there will be discomfort, and the discomfort is not necessarily a bad thing.
Yeah.
At the same time, it's not the patient's responsibility to educate the practitioner.
I've heard that said too, and it's true.
Right. I'm just not sure they have the energy.
But if we don't educate the practitioner, you know, because at the end of the day, guys, let's face it, we are the patients, right? And if I'm going to wait on them to be educated, I want to live, right? So I believe in self advocacy, and what you guys are doing and what we do here at Even Total Health, because we really try to get the word out and, you know, have these conferences every month and try to bring in these different viewpoints. So I do believe in that self advocacy. One of the questions that's on my mind is, you both 7 years ago, about 7 years ago, right, when you guys discovered you had this cancer, how did it affect? And you guys have an 11-year-old. How did you support each other while the both of you are going through? That had to have been challenging.
That is actually a good segue to goal 4.
Okay. All right.
I'm also writing notes to come back to some of the things that you brought up here. So for us, goal 4 is use this opportunity, the opportunity of showing the film, to expand the conversation, right? And there are 2 ways that there are many ways, and for this purposes, I'll name 2. One is that even though the film is about us going through cancer, it really is very helpful to use it to just think about transgender people's experience in the healthcare world.
Mhm.
It's not limited to oncology or cancer,
Mhm.
because what we are talking about is really the different aspect of thinking about someone when they're transgender.
Yes.
Let me put a pin and come back to that. And then the other way that we're expanding the conversation is related to the question that you just asked, is that we actually show more than we tell in the film about recognizing chosen family. We are obviously not blood related, but it's a very common thing. Chosen family is very common within like immigrant communities, communities of color, and queer communities.
How do you explain that? What's chosen family? Break it down for the audience who's not aware of what that term means.
Yeah, so I would say it's the opposite of what we typically think of as a nuclear family.
Yeah, gotcha.
Nuclear family is like, right, usually spouse and with children. And there's some blood relationship, there's marital relationship. We are chosen family because we decided that we will be each other's family. And be there through, right, like good things and bad things.
Yeah, better or worse.
Better or worse, and that we chose to see each other that way. And
in a way that is kind of what we wish family would always be. And sometimes the responsibilities that go with blood relations or with spouse relations is something that is a great story, but not always the reality. So with chosen family, we're making a commitment like, okay, I will be your annoying older brother and you will be my annoying younger brother. And what that basically means is if you need me, I'm going to show up.
Mm-hmm.
If you need help, I will be there. If I need help, I'm going to ask you. And it's that naming of saying, I am sharing a responsibility for you that makes it that, for me, that family connection.
Yeah.
And that's to me is a social contract, right?
Yeah. Yeah.
The problem is that our legal contract, our policies, federal policies, state policies, do not see that as family.
Right.
It is starting to change. So both of us have actually been active in helping to change the law here in Oregon. And so in Oregon, there is a definition, a wider definition of family when it comes to being able to take time off to care for a family member. How do we define that family member? Right now, it has become a chosen. The definition of family is wider.
Yes, which
How
is
that
good.
look, just for the specific, that means that if I'm accompanying you on to a medical appointment, I can take sick leave from my employer.
Oh,
That's how it works. So it's not just if I'm taking.
is that a policy where you're at, or is it, that's wow, that's I don't think that's the policy here in South Florida, but that's pretty neat. So you can get sick leave for accompanying your spouse, your partner. So that's
Well, spouse, partner, and chosen family.
and yeah, what I'm calling you guys that your unchosen family. Wow,
Yeah.
wow, wow. That's
Yeah, but you want's not my spouse,
oh.
right? My
You guys coexist. You guys live together.
right.
Who has a child?
Jeannie.
No,
Jeannie is my spouse, my beloved, and is actually the real hero of this story. So, kind of to get back to how this segment started, how did we navigate it?
yes,
She was the heart and soul of the house, and she was the one who was supporting both of us through that journey.
wow.
So it also, right, as we talk about chosen family and nuclear family, and with cancer diagnosis, it impacts the entire family. So I don't know if this is common, but again, in our experiences talking with oncologists, there is a more common practice of treating the whole body and knowing that, including when you said that your doctor sat down between you and your husband, right? Knowing that he was going to be an integral part of this journey, how important that is.
Yes.
So Jeannie was at those, Yuan was at those, because we knew it was going to impact all of us.
Yeah. Yes. That
but,
must.
But just as my friend,
Yeah.
I wouldn't necessarily be eligible to take paid sick leave from my work to accompany Yuan to an appointment. But here in Oregon, because we have a more expansive definition of family, I can take paid sick leave when I accompany Yuan to an appointment.
That's incredible. Now, has that been a long-standing rule, or is that something fairly recent? Because I've not heard of that anywhere else. That's incredible.
It took several years to advocate for it, and it became law a few years ago. It's relatively new, but not that new.
Yeah, it's a good law. Someone says my wife was adopted, and she was a chosen baby. There's also a book called The Chosen Baby. I like that term, chosen family, because what you're describing even sounds sometimes in the nuclear family. People wish they had other choices, right? Than what they're given. Wow.
Yeah, and well, the other thing I'll share too is the a lot of our policies and our practices in our society, the U.S. society, is very much catered to the nuclear family, but actually the nuclear family is the minority formation of family in the U.S. I don't remember the data now. I want to say it's like less than 18% or something like that. So we have a lot of catch up to do in terms of our policies and the way that we changing our mindset about thinking of what makes a family.
Yeah. I mean, I think you guys are educating us a lot today and what we're seeing, and just your support for each other. For me, it's very encouraging. It's very inspirational. And I really, just wish you guys the best with this message, because I think if people could see you both, and I'm sure your film is amazing, that not only will it just be that UC Davis, but so many other, even hospital systems, I think even their training, I'm just thinking some of these bigger, I mean, I don't know if you guys are going after those folks, but some of these bigger hospital systems, I mean, are they giving you guys an audience to at least educate some of their teams, their oncology teams, even in the primary care setting too, because that's where you guys all started, right? It was your primary care saying, hey, something's not right.
Yeah.
So there's such a huge need for this and such a huge audience. I'm just wondering, how are you guys getting it out there? So Sarah, who is our founder of Total Health, she says anything worth changing doesn't come easy. Health should be a basic fundamental right. That's what we believe here at Total Health. But there are so many nuances to the journey to health. So many. Keep fighting, like your story today. We often, as a Black woman, we often hear a lot about Blacks and clinical trials, and it's true. The underrepresentation, but the transgender story is as huge. And I'm just really glad that you guys again are getting your message out there. So yeah.
Well, what
So
else?
About the hospital system, I was just curious if you guys were making any headway there.
So we are taking the movie and going directly to hospitals, nursing schools, medical schools. But what I will say is that a few things. One is that these places are not used to having us be the educators.
Right.
They are not used to using storytelling and filmmaking as an educational tool. And a lot of times these systems are so huge, it's really hard to know where to go.
Mm-hmm.
The film is atypical, right? In the sense that it's considered an indie film.
Mm-hmm.
And usually, right, like with films like that, it goes into film festival. It doesn't have a long shelf life.
Mm-hmm.
We decided not to take that path, and we decided to use it as a tool to go directly to healthcare institutions. That's why it has such a long shelf life. But the other reason there is such a long shelf life is because there's a need.
Right.
But there are also a lot of barriers for us to get into these places for the reasons that I've mentioned before, right? And in the email earlier, I had mentioned that we even get resistance from places because we don't have PhDs, right? And there was a very prominent place that told us, like, can we just show your film and you don't present it because you don't have PhD, and we want to offer CMEs, and we have to have PhD people to talk about your film in order for them to qualify for CME. I mean, what that tells me is that how much do they actually value patients' experience? Right.
Wow, that's interesting. That's my boss is on here, and we are the largest provider of free oncology, and continuing oncology medical education in the country. And I can't speak to that what they said, but it just seems a little odd to me because I know I don't have a PhD, and I've spoken at our events and our CME events, so I'm not sure how that works, but that just sounds a little suspect to me. That's to me, but maybe my boss or Peter can chime in on that one. Let me. Okay, so this is what my boss said. She says we can offer CME without having a PhD present, because I know we're the largest provider of those oncology CMEs in the country. So when you said it to me, I'm like, I know I've spoken several times.
And we have to. And we have presented the film to the Veterans Administration, which is like the biggest healthcare system, right? And they offer CME, and so it wasn't an issue for them, but this particular place, it was an issue.
Yeah, that was to me, that was an excuse. I'm sorry. That was an excuse, and then you guys are used to that. You guys are used to the resistance and the block, but that was just an excuse right there. And before we I want to have you guys give me some closing thoughts. But someone said, send it to Shonda Rhimes. She's a difference maker and can use your stories on her dramas. It won't be your documentary, but seeing you represented on TV shows and movies helps us learn more. I believe I think I can speak for myself and the audience, just based on your comments. I mean, I know I've learned a lot today, and I really thank you both for being just open and honest with your story. And so my question to you is, for someone looking on, you never know who's going to see this video, right? What is we talk about your number one, your guys are goal guys, right? 4 goals. But if I were to say, what is the number one desire, for you right now with this film? What would be, like, if someone could wave a magic wand for you, what would be that thing that says, okay, I have one wish. What is that one wish?
Before we go into this, I just want to say that I think I can speak for both of us, that we learn a lot of medical stuff from the Gray's Anatomy Academy.
Speaking of Shonda Rhimes, we're big fans.
Don't we all, right? Dr. TV.
And she's the best at it. I think my answer to that is, how do we reach the people who aren't opting in? So getting it into core curriculum and elevating the patient perspective, using this as a tool to do that.
Okay.
Yeah. I mean, I think I named my magic wand. So we now have one school, right? Like taking our film and putting it into the curriculum. I mean, I know that there are other schools too, because we do screenings to, other places that have integrated this different way of, right, looking at sex and gender. So my magic one would be all schools, medical schools,
yes,
for the future MDs, but also nursing schools, any healthcare places. So here's the thing that I'll say is that what we are talking about, another way to talk about widening the conversation, right?
Mm-hmm.
Like, is we're using ourselves as trans folks, right? When what we are doing is pushing the status quo and the boundaries and the rigidity of thinking about gender.
Yes.
If we are successful in doing that, the healthcare world will be much better at serving anybody, including cisgender people. Cisgender is the opposite of transgender, right? And so I'll give you an example. I recently received a reminder from my insurance that it was time for me to get a pap smear. I had a hysterectomy. It is in their records.
Yes.
So I know that if I'm getting it, other cisgender women are getting it too. And it could also be among those cisgender women who have had hysterectomy, right?
Yes.
So it is sort of like the automatic. If someone checks the female box, we send this email out. If someone gets check the mailbox, we send that email out. So that's what I mean, that what we are doing with our film and with, just pushing for transgender inclusion will benefit cisgender people too.
Yes, it's bigger than just this. It's looking at the healthcare system and holding them accountable to look beyond check boxes. And I know they only have a few minutes, but I think what you're doing and bringing that awareness as one of your goals, you're right. It's going to benefit all of us. It's going to benefit all of us. Thank you so much again. Thank you for spending this time with us and for educating us and for the work that you're doing. Maurice is very true. And for those of us who can't reproduce and had to get a histo, because there's a lot of that too, it's a reminder of something really hard to think about, So I am just grateful to you, because not only are you representing the trans community, but you're right. You're representing the cancer community and you're representing all of us. So thank you very much. And thank you to the audience for all your questions. And if you guys are watching on the replay, we did put the website in the comments on all the platforms. how to get more information, it's www.trans. Let me just put it up here. Dudeswithladycancer.org, because you have to contact them to hear more about the documentary and how to get it where you're at. So we encourage you guys who are watching to please spread this news, share their website information. Those of you who are in the medical community, share this with just folks in that community, because I think their story needs to be told. And there's just a lot to it, and I think education is going to be the key. Let me just take this one last comment. transdudeWithLadyCancer.org. Brooks and Yuan, thank you again so much. And I'm just going to say bye to the audience until I see you guys on Monday. Take care, and thanks for tuning in.